Good morning, ladies and gentlemen. Welcome to the Catalyst webinar series presented by the Education Committee for the Southern California PGA. The Catalyst webinar series is a bi-weekly educational platform for creating success and change in your club and career. We are very pleased and proud to introduce Dr. Alison Curdt as our presenter this morning. Dr. Curdt has a doctorate in psychotherapy. She is a PGA Master Professional, an LPGA Master Professional, many accolades in her storied career. She's an LPGA top instructor in the country, three-time Western Section LPGA Teacher of the Year. She's the recipient of the SCPGA SoCal Teacher of the Year in 2016. She is also, in addition to being a golf instructor at Wood Ranch Golf Club and consulting for the Cal State Northridge women's golf team, she also practices clinical psychotherapy and is the owner and proprietor of Curdt Performance Therapy in Woodland Hills. Dr. Curdt, thank you very much for joining us this morning. Good morning.
Thank you. Thanks for that kind introduction, and thanks so much for everyone taking some time out of their morning to join us for this Catalyst seminar. I hope you have some vested interest in either some athletic trauma, or figuring out a way for you to tap into your best golf, which in the next 60 minutes, you're going to figure out how to do that. So the title of this presentation this morning is Tapping into Your Best Golf, the Art and Science of Bilateral Stimulation. Now that can sound a little fancy. What is bilateral stimulation? But guaranteed you will know what that means moving forward after today. So to get into a little bit of the lay of the land this morning, we're going to go into a bit of background of how I've combined my life with golf and psychology. So as John introduced, I am a full-time golf instructor, but I also have a private clinical practice where I work with clients of all different sort of sport backgrounds, CEOs, any sort of performer, actor, musician, trying to find the best version of themselves by healing from past experiences. So sort of like during the day, I'm a golf instructor, and then at nighttime, I'm a psychotherapist. And I have sort of an interesting story of what's led me to bridge both of these worlds of golf and psychology. And then we'll talk about what is trauma, and specifically athletic trauma. So to you as golf professionals and teachers, how is this really going to help you in your business, and how is this going to help you understand your students better, or even understand yourself better? That's going to lead us into knowing what EMDR is. EMDR is a psychological practice that is used throughout different sort of disorders and issues and adversities that people might face. It stands for eye movement, desensitization, and reprocessing. So you're going to have a complete understanding of how that can be used with golfers, or even used in your own golf performance. And lastly, we'll talk about a derivative of EMDR, which is tapping, the title of this presentation, also known as bilateral stimulation. So that'll be our plan moving forward. Give you a little bit of background of myself. I started playing golf at the age of 7 and really had quite a fantastic junior career that led me to earning a full scholarship at Florida State University. And I sort of went from this being a big fish in a small pond in the state of Missouri where I grew up, to now going into a top 25 school, competing against all these great ACC schools like Duke and Wake Forest. And then I sort of turned into this small fish in a big pond. And it was very difficult to compete at the level that I had anticipated to. Part of it was because a lot of my upbringing was based on the mechanical aspects of performance, and there wasn't a lot of psychology or mental performance that I was introduced to. The Dr. Bob Rotella books started to come out, and I picked up a couple of those from the local bookstore and began to educate myself a little bit about how to perform better, but really didn't have those philosophies introduced into my golf performance at that collegiate and beginning of my professional career. So as I worked through my PGA and LPGA membership and became a PGA golf professional, I really became inspired by helping individuals find the best version of themselves through golf. So not necessarily just how to fix their slice or how to play better on the golf course, but really understanding the student at a much deeper level, understanding what sort of things hold them back, what baggage they might be bringing to the lesson tee. I think in a way, golf professionals are oftentimes therapists and mentors to our students as they talk about different challenges they might have or different struggles they might have in their life. You might have that student who just comes up to the lesson tee who had a really difficult phone call from work, maybe a business deal fell through. That ultimately may influence how the lesson goes with you right in front of your eyes. And so that inspiration led me to go back to master's school and earn a master's degree in clinical psychology, which led me to become licensed as a marriage and family therapist and a professional clinical counselor in the state of California. Now, that title of a license can be misleading, like I'd be working with couples and families on their marriage, but really that's just kind of a fancy name for relationships. And we have a relationship with our students, we have relationships with the game of golf, and we have relationships with our family and our friends. So in that relationship business, because we all are in the service business as golf professionals, I wanted to be able to help my students improve their golf game through a multitude of different levels, not just physical performance, but also mental performance. And of course, through my own education, that certainly has helped me become a better performer and a better golfer. But my own personal goals didn't stop there, and I decided to pursue a doctorate degree in clinical psychology with an emphasis in sports psychology. And that certainly has led me to have some wonderful industry recognition through the LPGA and the PGA, which really validates the experience and the hard work that I'm doing with my students to help them ultimately become the best golfers they can be. So let's look at some of the common issues that may impact your performance as a golfer. I'm sure there's maybe several of you who have just competed in our SCPGA Section Championship the past 3 days, which was a wonderful event. And maybe a couple of these events impacted your performance the past week or in your golf career. Athletic traumas, we're going to fine-tune that definition for you today. We have communication. You as a teacher are in the business of communicating with your students, with your coworkers, with your bosses. But our students, whether they're at the professional level or the amateur level, they're communicating with you as the teacher, maybe teammates, caddies, or other sort of individuals in their environment that could be impacting their performance. Goal setting. If we don't have clear and crisp goals, we don't know where we're going in our golf lessons or where we're going in our golf career. How to regulate our emotions. So when we hit that shot, we're not happy with, how do we take the experience of the emotion and use it as a positive and learn from it rather than having it destroy the rest of our game. Self-confidence or lack of self-confidence can certainly impact our performance. The ability of our concentration levels. We have so many different forms of distractions that are available today with social media and our technology that sometimes our concentration levels can be wavering. So having improved concentration can enhance our performance. The ability to relax in pressure situations. A lot of our students can oftentimes be nervous just at the lesson, but certainly nervousness going into a competition can impact performance. And then anxiety-based disorders such as the yips. Many of you may have had a student who has suffered from the yips, and it can be looked at through one theory as being tied into an anxiety-based disorder. And lastly, imagery and visualization. If we don't have clear images of what we'd like to do, or we don't have an ability to visualize how we'd like performance to be, that can certainly negatively impact our performance. So I want to ask you a question. As you're sitting at home or at your office this morning, think back in your own golf career, whether it's playing recreationally or playing professionally. And I'm wondering, have you ever experienced from a round of golf any sort of memories about a failure in performance? Maybe you stand up on the first tee and memories of hitting shots out of bounds, start to flood your mind? Have you ever had any dreams about a failed performance or fear that it might happen again? If you've hit one shank, you certainly know what that feels like, and that can start to create some fear-based responses, maybe even dreams about what that might be like if it happened again. Have you ever had any flashbacks about a shot, a poor shot, or a sense of it happening again? I know certainly at the 2 golf courses that I played earlier this week, there were a few holes that definitely triggered me and had some flashbacks about shots I did not want to hit. Have you ever experienced anxiety or nervousness when you get into a similar situation as when you have failed in the past? Perhaps standing over a 3-foot right to left slider. You've missed those in the past, and you get into that situation and it creates some anxiety and nervousness. Have you had any intrusive thoughts or negative feelings about a performance ever? Have you ever made any attempts to avoid that distressing memory, that distressing thought, or the uncomfortable feelings? Some people might smoke on the golf course because it helps relax them and they don't have to think about any sort of negative things that might come up. Some people might drink on the golf course. They might use talking as a way to distract themselves. Have you ever made any attempts to avoid the situation in total that remind you of the failed performance? For example, there's a golf course that you just don't like because you performed awful on it, so you decide never to play that golf course again. Well, interestingly enough, this is actually the criteria for post-traumatic stress disorder. Now, not to say that any of you that have experienced these things have PTSD, but it kind of leads you into thinking that if you maybe have experienced some of these things from around a golf, then certainly our students have had these similar experiences. And if these can start to almost fit the criteria of PTSD, then we need to have tools in our toolbox to help our students and help ourselves be able to cope better so that our performances don't have to be destroyed and we can actually enhance our performances. So I want to show you a short video of perhaps what we might think of as a golf trauma or an athletic trauma. Some of these you maybe have seen live on TV. A couple of these from the past several years, certainly notorious in my mind watching them on TV. As you watch some of these players, a collection from the PGA and the LPGA tours, you can certainly see the amount of frustration and emotion that they might go through, or the thoughts that they go through in their mind after some of these golf traumas. And interestingly, when we use that term golf trauma, we're sort of looking at it from a subjective point of view. What may impact you and resonate in your memory certainly might be different than, let's say, Lexi Thompson, whose shot goes in the water could cost her thousands and thousands of dollars. This particular video to win the Kraft Nabisco Championship was heartbreaking for everyone watching, certainly for the player herself. But some of these missed shots can cost a player thousands and thousands of dollars and certainly resonate in their memory banks for an extremely long time. Certainly hope nobody had the dreaded 4-putt at the 2 golf courses this past week, or any sort of whiff. We all know Jordan Spieth, and super heartbreaking and emotional at the Masters. And then interestingly enough, the year following, it's sort of like the same disaster happened again. So I'll spare you the remainder of the traumas as we move forward here. Hopefully we haven't given you trauma by proxy by watching that collection of videos. I know it can certainly be tough to watch all of those shots, hoping that those don't show up in our own personal golf games. But that certainly leads us into this next topic of what exactly is trauma. So looking up the dictionary definition, just the word trauma in itself is a deeply distressing or disturbing experience. Well, for a tour player, missing a 2-foot putt to win the U.S. Open can certainly quantify as a deeply distressing or disturbing experience. Well, the American Psychological Association had a long-standing definition of trauma that was very limiting, and that was experiencing an event where you actually felt that your life was in danger, that death was being threatened to you or serious injury. The physical integrity of yourself could potentially be threatened. And there was certainly horror involved, fear involved. That's a very limiting definition because that sort of puts you in a category of being violently attacked or having terrorists attacked or being in a massive accident, plane crash or car accident. That certainly doesn't apply to us in the field of golf. Those things don't really seem to happen on the golf course. But that definition started to evolve, and then the most current definition by the APA, which is located in the DSM-5, which is basically the Bible for psychologists and psychotherapists of all sorts of different disorder and challenges that individuals might face. The most current definition is a deeply disturbing event that can interfere with your sense of control. It can reduce your ability to integrate the circumstances into your current reality. What that really means is that you become very, very vulnerable to the environment. And sometimes it's hard to acknowledge or hard to validate this really awful thing that happened to you. So you can see how that definition of trauma is really quite open. And that could be shanking a shot that really impacts you. That could be losing a big tournament going into a playoff that impacts you for years forward, or missing the cut when you really had expectations and a desire to make it through the final stages. So if we take that term and we put the word athletic in front of it, and we look at how these deeply distressing events occur in the course of our performance, we want to take a look at basically two types of trauma. We have large T trauma and small T trauma. So large T trauma isn't what's really applicable to us as golf professionals, but these are some of the things that are, violent crimes that occur to an individual, natural disasters, or these massive accidents that might destroy hundreds of people's lives. These are going to be the biggest sources of the diagnosis of PTSD and severe distress. But what we see most in athletic performance is what's called small T trauma. And these are going to be major failures and losses. This could even be considered divorce, getting fired from a job, massive humiliations, severe conflicts in interpersonal relationships, the destruction of a player and a caddy relationship. We also call these adverse life events. When I think back to my own personal playing career, one of the small T traumas that come up for me that I worked through in tapping and EMDR was my loss of the Missouri State High School Championship. I was on the 18th hole of the end of the second day, completely in the lead to win state championship my senior year, and ended up scoring a 7 on the last hole, which finished me in second place, runner-up. And so I carried that small T trauma with me for many years, which impacted my performance until I was able to work through it. So you may resonate with that story and think back to some of your own personal golf failures, if you will, that have occurred on the golf course that you might still be carrying with you. Now, the effects of small T trauma can be great for a performer. That can turn into the development of yips. And one of the theories of yips is that it is an anxiety-based disorder, which means the fear of it happening again can actually cause it to show up. So if you have shanked a small chip shot and you fear that it happens again, all of a sudden that anxiety mechanism starts to pop up And the motor pattern then presents itself to where we now have yips that have developed. Small T trauma can also decrease and chip away at your self-esteem, certainly increase any sort of self-doubt, anxiety, fear. You then start to kind of feel this hopelessness feeling, this helplessness feeling, like I can't get away from this particular shot, or I'm never going to be able to break through and win this tournament. In fact, it might even get to the point where you just avoid that situation in total. For example, for me, I hated playing the golf course Industry Hills. I never seemed to play well there. So I avoided any sort of tournament that was at that golf course until I finally broke through and worked through some of the different memories that I had on that course. And now I'm able to play it, and I don't need to avoid that situation any further. So in order to understand a little bit about how trauma impacts our brain and the reactions that we might have going on in our mind, we need to know a little bit about the different mechanisms in our brain. So I've pulled up a video, and I would do this live for you, but we're going to be looking at Dr. Dan Siegel's hand model of the brain. Now, you won't be able to hear any of the audio, but I'm going to walk you through what Dan is doing on the screen. And so at home, I'd love for you to try this. Basically, I want you to hold up your hand, and we're going to be looking at the different structures of our brain. If you fold your thumb in and wrap your hands over, as you see on the screen, let's talk about those different structures. So the thumb that you rotate into your palm, we're going to call that the limbic system. The forearm connecting into the hand, we're going to call that your spinal cord. Going into the brain stem, as you can see on the screen here. And as you roll this thumb over, I want you to look at your fingernail. We're going to call that the amygdala. Now, the amygdala is responsible for holding the emotional content of memories. So fear, flight or fight responses, the emotional components of memories are going to be stored in that thumbnail called the amygdala. Then as we start to fold our hands over, we're going to be calling this the cortex. And the cortex is basically what helps us understand and perceive the outside world. The front part, up by the knuckles, we're going to call that the prefrontal cortex, right behind the forehead. Now, what that does is that helps us with logic and reasoning. So as we fold this whole structure over, we have the cortex that's really kind of holding in the limbic system. And so sometimes in life, we can have all sorts of different things occur to us. We might be triggered. Someone might push our emotional button. We're tired. We're stressed. And when that happens, we can literally flip our lid. And what that means is we lose control of our flexibility, our balance, our connection of being tuned in. We basically don't make rational decisions. We make poor choices. If you've ever experienced an intense amount of anger or frustration on the golf course, your next shot might then be impacted. And this is really just about the anatomy of the brain and what is happening. So if we can look and see what happens in our brain through this hand model, we can then better understand how to control it, which really comes down to our limbic system and the amygdala, how memories and the emotional components are stored. We have to keep in mind that nearly all of us have experienced trauma at some point in our life. And in fact, research shows us that 90% of the population will be exposed to at least one trauma situation. But the norm is that most of us are exposed to multiple traumatic events. So if you've ever lost a job, gotten fired, gone through a divorce, had a sick child, these are all multiple traumas that build up in our life, and they get stored in our brain, which can trigger us moving forward. So again, the amygdala is sort of that memory keeper of the emotional components of events. And it's responsible for that perception of anger, for fear, for sadness, but even for joy. When that becomes triggered, it then impacts our behavior moving forward. Now, when a memory is stored in our brain, there's multiple components of what is being stored. So the picture of the event, so let's take a golf shot. The picture of the golf shot is then stored in our brain. The physical sensations about what happened are stored. So it could be the emotional content of what you experienced after the shot was hit, could be the sensation of actually what the poor shot felt like in your body. And then next, the belief about yourself is stored. So maybe you hook a shot out of bounds. You have a picture of the hook, you have a feeling of the hook in your body, and then you have a belief that I'm not good enough. That all gets stored into your brain. What then happens is memory of that event hangs out in what's called short-term memory. And it hangs out there until we go to sleep. When we go to sleep, there's a structure of our brain called the hippocampus. And that will take memories from short-term memory and it will store it and file it to long-term memory. And the reason why that's helpful is because it allows us to learn. So for example, when you were a child, if you touched something hot, that information was stored in your short-term memory, like there was pain involved. Mom yelled at me for touching something hot. I'm not supposed to do that again. When you went to sleep, all of that information was stored into long-term memory, and then you learned not to touch things that were hot. So that is called adaptive learning. We basically take things from our memory to help us survive. When we go to sleep, there is a stage of our sleep called REM sleep, and it occurs about 90 minutes after we fall asleep. If you've ever seen somebody sleep, they've got their eyes closed, you might notice that their eyeballs are moving back and forth in their head really rapidly. That's going to be the REM stage. Now, when that is happening, that is the process of that short-term memory being filed into long-term memory. So you can tell why sleep is so important, because we need those memories filed for long-term for adaptivity, but it also consolidates the day's information. Sometimes you might be really weighed down heavily with what's happened to you throughout the day, and after you have a good night's sleep, you might actually feel a bit better the next morning. That's your brain at work doing some really, really good filing of all the information that you've got stored in there. What also happens is that the memories are stored in networks. So you might have putting memories, you might have shipping memories stored together, or driving memories, performance memories. An example of a memory network is if I say apple, your brain might go to orange, banana, strawberry. So by saying and triggering the word apple, your memory goes to the network of fruit, and it starts pulling up all these different fruits that you have learned about. So if we take that to golf performance and we talk about the first tee performance, your brain is then going to go back to its network of all the times that you've performed on the first tee. Maybe it's been positive performances, and maybe it's been negative performances. So all of those memories are networked together. When we look at those stored memories in the brain, the positive ones, the ones that we're able to pull information from and learn from, those get filed correctly and adaptively in long-term memory. But sometimes when there is an event that is so emotionally triggering and it's really, really pertinent to you and it's distressing, that memory becomes stuck and it therefore becomes maladaptive. Our brain is not able to pull information from it for learning, and it ends up just sort of hanging out and becoming this open wound that triggers us moving forward. Those stuck memories serve as performance detriments. They destroy performance moving forward. So taking a look at the photo of Lexi Thompson here, she appears pretty close, maybe about a foot and a half away. I certainly had one of those missed putts this past week, if that gets stored in a maladaptive way, maybe that's on the 18th hole to win a particular tournament, and the emotional response to that missed putt is so great, then that memory does not get filed adaptively, and it stays in this place where it then becomes triggered. And it becomes triggered in a way that it's an automatic response. What I mean by an automatic response is if I say, roses are red, in your mind, you might be saying, violets are blue. That's an automatic response. That's embedded in our brain. Well, this stuck memory becomes an automatic response. So the next time she's at a foot or a foot and a half away from the hole, her body will re-experience the feelings associated with that missed putt, the image of that missed putt, and the negative beliefs associated about her putting skill. These traumatic memories, they are stored in a raw and maladaptive form, which means they are not processed correctly, and they really serve to be re-experienced moving forward. And sadly, that means that your performances will then be impacted just based on those raw and maladaptive memories hanging out in your brain. Now, memories are stored in what's called an excitatory state, which means they can become distorted. So a missed putt to me at 12 inches is going to be stored differently than, let's say, a missed putt for someone who is in the lead by a stroke and they're on the 17th hole. So it's very subjective based on your own personal experience how those memories become stored. I want to share an example of different types of trauma and how they can impact golf performance. I worked with a client who had been playing golf for about 30 years. And when we talked about the different performance issues that she was having, she felt like no matter how many lessons she took, no matter how well her skill was fine-tuned, she was still doomed for failure. She was still unable to break through her performance barrier of breaking 90. So as we looked at her past, we discovered that there was a swimming incident that occurred in her teenage years that was actually impacting her performance 30, 40 years later. Now, she was an elite swimmer back in her teenage years and was actually on track to get into the Olympics. And at the pre-Olympic trials, she was on pace to beat her record and qualify for the Olympics. But during the race, a crazy thing happened, and all of the lights in the swimming arena turned off. The electricity went out, so the clocks went out, the lights went out, and they stopped the race. So everyone got out of the pool, they got things fixed, and then they started the race again. But this time she wasn't on track to make it to the Olympics, and she felt like she was doomed. So that trauma was so impactful for this particular student that as we looked at her golf game in the present day, we realized that there was a connection. Anytime that she was on the brink of greatness, she felt like she was going to be doomed, but the lights were going to go out on her again. So you can see how things that may not be directly golf related, they may be in other sports or they may be in life in general, can impact you moving forward in your performance. One of the things that helped this particular client, as well as many of my other clients, was going through EMDR. Now, EMDR, eye movement desensitization and reprocessing, is a type of psychotherapy that takes these stuck memories and reprocesses them so that they can become adaptive, so that we can learn from them. And we can desensitize the emotions that have been stored with them and file them in long-term memory. Basically, the theory of EMDR suggests that anything that is a disorder or anything that's maladaptive for us, we call that psychopathology, it's due to the maladaptive encoding of these traumatic events in our brain. And it looks at memories in a three-pronged approach. what has happened to us in the past will impact us in present day. That then sort of dictates the terms for our future. So an athletic trauma that occurred 20 years ago can impact my performance now, and is certainly going to set the stage for my future performances. EMDR can be used for depression, for anxiety, certainly for PTSD, but it can also be used for pulling positive memories from our past in order to set a template for future success. So if I'm preparing for a tournament next week and I really want to pull up some positive examples of performing at my best, I can use EMDR to really solidify those positive performances. Or if I'm scared about some things that I've experienced in my past and I want to process those and make sure that they don't trigger me, EMDR can also be used for that as well. Bilateral stimulation is basically the right and left side of our body and activating that. That can be used in moving the eyes back and forth, as we see in REM sleep. That can be used in tapping. So if you tap the right and left side of your body, or what's called butterfly hugs. If you cross your arms across your chest, like you're giving yourself a hug, and you tap your right and left shoulder, which sort of looks like butterfly wings, that's called a butterfly hug. So EMDR basically uses the eye movements in a waking state, when the eyes are open, moving back and forth, so that we recreate what happens in REM sleep in a conscious state. That means someone can work through their memories in the present day so that they no longer trigger them. So how does this thing work? Well, if we're moving the eyes back and forth, or we're tapping the right and left side of our body, we're activating the stuck memories. And when we focus on the traumatic memory that we have in our brain, and we do something else, like tapping or moving our eyes back and forth, then it taxes what's called working memory. And when we tax working memory, we can actually desensitize the intensity of the emotion. There's been some really phenomenal studies done where children have been in traumatic accidents, let's say a car accident or something has happened in their home, and researchers have shown movies to the children right after the trauma, and the children have recovered faster because it basically took the intensity of the emotion of what happened to the children and it taxed working memory while doing something else, watching a movie, and ultimately they didn't hold as much pain with them moving forward. For example, you might feel like you've got a lot of stuff weighing on you, and so you go take a walk to clear your mind. Interesting that we say to go clear our mind, because literally that's what happens. When you are thinking about something really heavy or thinking about something that you are trying to figure out and you're walking, you're using the right and left side of your body to walk. So you are taxing your working memory as you're walking, and it desensitizes the intensity of the emotion, and it allows you to create a little bit of psychological distance between the pain of the event or what you're trying to figure out in your body. So in working with a golfer who would want to heal from athletic traumas, the first thing they would do would recall the worst part of the event. So let's say a player has hooked a shot out of bounds, and that is really stuck with them. So they're going to recall the worst part of that image. They're going to locate where they feel it in their body. Maybe they feel it in their throat, or they start to feel like their throat is tightening up and their shoulders are tensing. And then lastly, they're going to verbalize their beliefs about the event. They might feel like they're not good enough, or that they're not skilled enough to perform at the level that they want. Holding those three things in mind, the belief about the event, where it's located in the body, and the picture of the worst part of the event, when you tap back and forth, when you use eye movements back and forth, it processes that memory and it activates both hemispheres of the brain and allows the memory to become less activated. And it begins to heal it and allows the individual to process it so it no longer triggers them. So for example, in my own personal story that I shared about my loss at the Missouri State High School Championship, coming in on those final holes impacted my performance moving forward. So anytime that I was in a position to win early on in my career and I got to the final hole, the image of the worst part of the event, where I felt it in the body, and the beliefs that I had about that event were activated. And through tapping and EMDR, I was able to process that memory and not have to allow it to destroy my performance moving forward. Now, EMDR can only be applied to an individual through a licensed clinician. So as golf professionals, unless you go through my route and become a licensed clinician, you're not going to be able to do EMDR on your students. However, you knowing about EMDR might allow you to refer your students to a licensed therapist so that they can start working through their trauma, or you can start working through your golf traumas. However, tapping is a derivative from EMDR, and this is something that you can do for yourself, and you can also introduce your students to it. Now, tapping, there's several examples on the screen of what that looks like. We've got the butterfly hug in the lower left corner. We have what's called tappers in the upper right-hand corner. These sort of vibrate in your hand back and forth. Or we have tapping on the knees, or you can tap on the side of your body. Tapping is used basically in two different examples. In a time of need, and also setting resources for the future. So in a time of need, when you are feeling anxious, you've got low-grade anxiety, you're a little uncertain about an event, you can use tapping to desensitize the emotion and bring yourself to a place of calm. You can also use tapping to help prepare yourself for an event that you might have coming up. Resources are basically the positive qualities that you would like to show up in your performance. So if you're heading into a tournament and you'd like to be confident, then confidence is the resource. So you'd want to scan back in your memory bank and look at different times in your life on the golf course that you felt confident. You want to notice where you feel it in your body. You want to notice the picture of what it looks like. What does confidence look like? Where were you? What course were you at? What shot did you hit? And you want to really hone in on the positive sensations. When you have that picture, when you have that feeling, and when you identify the belief of confidence, you can tap back and forth on your body at a slow pace 5 or 6 times to really solidify the resource. You can strengthen the resource through tapping, so that when you get into a situation where you're feeling uncertain and you'd like confidence to show up, you're then able to tap into confident states so that you can perform better. So at home, you can certainly try what tapping would feel like. So I'm going to walk you through a couple of steps here, and feel free to try it. Just kind of gives you a little sample of what tapping would look like. I want you to select an area of your game that you wish to improve on, a place that you wish to perform better. So for example, maybe you want to make 4-foot putts under pressure. Okay, so notice that. Then I would ask you, what qualities, or the term resources, would you need to be successful? So if you want to make more 4-foot putts under pressure, what qualities do you need to make 4-foot putts? Do you need confidence? Do you need a sense of calm? Do you need better focus? So identify for yourself, which qualities or resources do you need? Now, I want you to bring to mind a memory or an experience that you can think of when that quality has shown up. So are there times in your life when you felt confident over those 4-foot putts? Do you remember a specific putt that you made that sticks out in your memory, a crucial putt? Are there images of these putts that you can pull up? Now, sitting in your chair, I want you to take your hands and just put them on the edges of your knee. And we're going to be tapping slowly back and forth. You just put a little pressure on the tips of your knees, just back and forth. We're going to activate that resource. So while holding the picture in mind of the resource that you'd like to tap into, while holding the belief about yourself in mind, while holding all of the qualities of that memory in mind, we're going to tap back and forth, right and left, for a couple of seconds. Okay, go ahead and take a deep breath. Now, the process moving forward is that you would go through this several times to really strengthen the resources. You might even start to feel a sense of calm. You might even start to feel some joy or happiness when you recall those memories as you tap back and forth. In fact, you might even use this in the course of a round of golf. When you get into that place of wanting to be confident over a 4-foot putt, and you're standing behind the putt and you're reading the break, you might tap on your legs back and forth. Or I've even had players who start to squeeze their toes in their shoes. So no one's really actually seeing them tap, but they're using the right and left bilateral stimulation activation. And they're tapping into those resources right before they head up to the putt to hit that. You can then take it a step further. And after you've tapped into those resources several times, you can imagine putting yourself in a situation in the future and seeing yourself play confidently, seeing yourself make 4-foot putts. Where I use this with my students, once I teach them how to tap, and we figure out the best way for them to either do this on the golf course or to do this for prep work, we certainly talk about playing a golf course in their mind before the actual event. Some of you may do this. As you're prepping for a tournament, you might have your yardage book, you've already played the practice round, and you're walking through hole by hole. Well, as you're walking through hole by hole, tap into the resources you're going to need in order to pull off some of the shots, in order to play the way that you want to play, to set a future template for the future. This is tapping into your best golf. So as we've looked at EMDR, EMDR would be used for healing the athletic traumas that trigger you moving forward. Tapping would be the tool that you add into your toolbox to set the future template for success, to tap into resources, the time that you have played your best golf so that it shows up more frequently when you're ready to perform. That is tapping into your best golf. So I thank you so much for your attention this morning. I thank you for jumping in on this catalyst. I've left a little bit of time for some questions because I'm sure a lot of these concepts may not have even been introduced to you at all. Certainly applying to the golf industry field can certainly be a little complex. So I'm happy to answer any questions for the next couple moments. But again, thank you for joining me on this catalyst and letting me share something that I'm really passionate about and something that has certainly helped a tremendous amount of my students be their best version of themselves and perform their best.
Thank you very much, Alison. Amazing, truly amazing. The content, remarkable. We have some questions that have come in. Do you see a similarity between, assuming that there are students that you work with in terms of their marriage as well as their golf game, do you see similarities in conflict resolution in terms of the golf games and their interpersonal relationships?
Well, I would have to say that one's communication style would really be the only similarity that I would see. So how someone maybe communicates in their marriage or with their family is certainly going to show up how they communicate with an instructor or how they communicate with their peers. That communication style is a similarity, but I would say that I do see a correlation between what is happening in someone's personal life to what happens in their golf performance. I think Tiger Woods is kind of the elephant in the room when we talk about a personal life interfering with one's golf performance. The things that we saw happening through his marriage and the different issues and challenges that he was going through certainly destroyed his best performance. So when we try to help our students play their best, obviously having a life balance harmony is ideal, but that's not always the case. If a marriage or if issues in the family can be healed and worked on, it certainly brings less baggage to their golf game.
And hopping over to eye movements, can eye movements substitute for a good night's sleep?
That's a really, really great question. I've never been asked that. That's a brilliant question. Sadly,
I usually
no.
I usually don't announce the question asker, but that's from Billy McKinney.
Of course it would be. Yes, of course it would be, because he's so brilliant and Teacher of the Year. Congratulations. No, so you cannot just replace eye movements for sleep, because you have to keep in mind that the eye movements is one stage of 4 for sleep, and the eye movements are just indicating the consolidation of information. So you still need those other 3 stages for your body to fully rest. So we can't be awake 24/7 the rest of our lives. But the eye movements are absolutely beneficial to adaptive learning and taking what has occurred in our day in short-term memory and allowing it to get stored into long-term memory.
Do you incorporate the breath for calm and focus for tournament play?
Most certainly. I think all of us as golf instructors should definitely educate ourselves a little bit on breath work. I personally have done my own research on breath work and understanding how to breathe differently. What I like to show my students is placing a hand on your belly and a hand on your chest. And when they breathe, they look to see which hand raises. So if the hand on the chest raises, then they're a very shallow breather, and they're not completing the full exchange of oxygen and CO2 in their breath. So it's super shallow, which can certainly increase heart rate and tension. Now, if the hand on their belly is the one that lifts up, then we know we are making a full exchange of that breath, and that would be more considered belly breathing, but a definitely deeper sort of sense of breathing, which is extremely helpful. So in working in pre-shot routines, I teach my students on how to have those belly breaths. In dealing with the emotional intensity after a shot, hitting a shot and experiencing that rush of emotion, whether it's elation or whether it's aggression and anxiety, whether it's being frustrated, using the breath can certainly help desensitize that emotion. Now, I'll share with you one of my techniques very quickly that I use with breath work that all of you can bring to your students today on the lesson tee. When a student is experiencing an emotional reaction to a shot, what I do is I have them find in their body where that emotion is hanging out. So maybe they say it's in their chest. Then I have them form a shape about the sensation. So maybe it's a bunch of triangles. Then I have them color the sensation. So they might say red or orange. So now we've got the sensation that's in the chest. We've got these triangles. We've got them that are red or orange. We have them name it. So it might be frustration or anger. So now we've kind of quantified what this experience is. Then by using deep breath, I have them visualize inhaling and then exhaling those red or orange triangles called frustration that are hanging out in the chest. The process of doing that copes with the emotion so much faster that you can do it in the course of in between shots. And that's how I use breath for coping with the emotion.
Very well. Well, those are all the questions that we have for this morning's Catalyst. On behalf of the Education Committee for the Southern California PGA, we would like to extend a very deep thank you and gratitude to Dr. Curdt for her time and effort in presenting to the section this morning. As usual, a 10-question quiz will be going out here shortly on the content of this morning's Catalyst. Please take the quiz. We will also attach the YouTube recording of this morning's presentation. Take the quiz and return it to Sharon Kerfman at pgahq.com. A score of 70% or higher will earn 1 MSR credit for attending this morning's Catalyst. Thank you very much, Dr. Curdt, and have a great day, everybody.